Evaluation and treatment are essential skills for an athletic trainer. This week, we will be introduced to a basic understanding of the common evaluation and treatment techniques used in athletic training. Let's begin by briefly discussing the basic information on the common evaluation techniques used in athletic training. In athletic training, 4 distinct evaluations are routinely conducted: the pre-participation examination, the initial on-the-field injury assessment, a more detailed off-the-field evaluation, and a progress evaluation, all of which we will discuss today. The athletic trainer who is examining a patient with an injury must have general knowledge of normal human anatomy and physiology, biomechanics, an understanding of potential hazards inherent in a particular activity, and must be able to understand and be able to document. The first piece of information that the athletic trainer should collect on each athlete is obtained from an initial pre-participation examination before the start of an upcoming academic year or the first practice. The primary purpose of the pre-participation exam is to identify an athlete who may be at risk before he or she participates in a specific sport. It also allows comparisons from one year to the next with regard to growth and development, weight gain or weight loss, etc. This examination should consist of a thorough medical history, a physical examination, a cardiovascular screening of some kind, a maturity assessment, an orthopedic screening, and a wellness screening. The on-the-field assessment is what most people think of or describe when they are discussing what an athletic trainer does. Quote unquote, it's the person that runs out on the field when someone gets hurt. That is an athletic trainer. Where this is true, that is part of what an athletic trainer does, that is not the main form of evaluation, but we'll get into that in a second. The AT that runs out on the field talks to the athlete a bit, then either calls the ambulance over or helps them off the field. They are completing an on-the-field assessment. This is completed immediately after acute injury to rule out injuries that may be life-threatening, to determine the immediate course of acute care, to determine necessary first aid, and to determine the approach to handling emergency situations. It is conducted in 2 different steps: the primary survey, then the secondary survey. The primary survey looks for any potential life-threatening situations, such as checking the airway, breathing, circulation, level of consciousness, these type of things. And if there are any life-threatening situations present, it is handled in an emergent manner and emergency services are called. Next is a secondary survey. This is completed by quickly figuring out what the severity of the injury is, how it can be treated, and how they can be removed from the field of play. A more detailed off-the-field injury evaluation is performed routinely after the immediate on-the-field evaluation, either on the sidelines or in the athletic training clinic, a hospital, an emergency room, or a physician's office after appropriate first aid has been rendered. The evaluation scheme is divided into 4 broad categories: the history of the injury and the patient. This is done by obtaining as much information as possible about the injury and the patient. An observation of the injury and the patient, so getting a general idea of how they look and how the injury reacts to certain stresses. The palpation of the injury and the patient, so both bony and soft tissue palpation. And special tests, the movement assessment of the injury. To remember the sequence, use the mnemonic HOPS, history, observation, palpation, special test, to know how to complete a full and thorough evaluation. If appropriate, the examiner can also test the patient's function to see if there is any chance of immediate sport return. All of this is done to make a clinical diagnosis of what the patient is experiencing. Finally, the progress evaluation. This evaluation is saved for when an athletic trainer is overseeing a rehabilitation or treatment program and wants to document how the patient is progressing. To ensure that the progress evaluation will be complete, the athletic trainer still needs to go through the certain aspects of history, observation, palpation, and special tests. We will end this discussion by briefly talking about common treatment techniques used in athletic training. Once an injury has been diagnosed, the next course of action is deciding what to do for that patient so that they can return to their activity as close to how they were prior to the injury. This can come in many different forms. Primarily, surgery, rehabilitation exercises, modalities such as ice, heat, ultrasound, electrical stimulation, etc., medication, manual therapies such as stretching and joint manipulations, and newer techniques such as the use of kinesiotape, cupping, and dried needling for those certified and able to practice can be used as well.